And when we do discernment about ordinary, extraordinary means, we look at 6 factors really. Patient preferences, and that's where healthcare directives become valuable to know what that patient would desire. Risk, what are the side effects or the negative possibilities of certain kinds of interventions, complications that might arise in treatment. Some interventions can cause a lot of symptoms and side effects that are maybe more burdensome than the benefit of the treatment. Expense is a factor. It's not the determining factor, but it can be a factor in determining a line between extraordinary and ordinary means of intervention. Hope is a 4th factor, and what we mean by hope is that this intervention would be effective. We would hope that it would have, we have a reason to believe it would have a beneficial, positive effect for this patient given their condition. Availability. Availability for this patient in his or her condition as well as in the facility I'm in. The most important, I say for last, is benefit versus burden. And this goes back to that document from the Congregation for the Doctrine of the Faith. Those things that impose excessive burden or are ineffective for that patient in terms of providing comfort or extending their life are extraordinary means, and therefore can morally be foregone or discontinued if they're already in use. People struggle with that sometimes because they feel, I've done something to end this person's life. The Church is very clear that what would cause death, we sometimes call it the principle of double effect. What would cause death is not what we are doing or not doing, but the underlying illness that we are no longer artificially countering. So we allow a natural death to occur. This is the key distinction with euthanasia or assisted suicide, where in euthanasia or assisted suicide, we introduce a cause of death that wasn't there before. So whether it be a lethal injection or deliberately removing nutrition, hydration in order that the person would die, those are things that we are doing or not doing deliberately in order to cause death. That's different than an underlying pathology, a fatal condition that we simply no longer are preventing from reaching its natural conclusion.